Welcome to the Money Script Podcast. It's your host, Yo Harrison, Yohance. It's whatever rolls off your tongue works for me as long as you say Han, not Han. Han, not Han. Yohance. Y'all got it? Okay. I'm here on the Money Script Podcast as your host. For those of you, if this is your first time listening in, since I know my guest is probably going to share this with lots of his friends, so you may be listening for the first time. You're wondering, what is the Money Script Podcast? It doesn't have anything to do with prescriptions unless it's a prescription for your finances. I'm a financial advisor. I help people make better decisions with their money. The purpose of this podcast is just to be a platform to promote financial literacy, to get you thinking about your money in more strategic and tactical ways, and not just letting your money happen to you. So what we do is I get on the show about once a week, have a guest. We'll talk about what's going on in their life. We'll talk about money. We'll talk about how we can promote whatever it is they're doing, because I also am a huge fan of self-promotion of whatever business that you have or business you want to get into. We get to help each other out in this world wide web and share that. So whether you're listening to this on a podcast or you're watching on YouTube, do yourself and someone else a favor. Tell a friend to tell a friend to tell a friend to get their financial literacy on. I am here today with an amazing individual that I had the pleasure of meeting and hearing speak on several different occasions. I'm more excited. The thing I'm most excited about him being on the podcast is that he is an alumni of my soon-to-be alma mater, Morehouse College. Ladies and gentlemen, without any further ado, please welcome Dr. Italo Brown. How are you, sir?
Thank you for having me. I am having a good day so far. I mean, it's Friday. I work later on, so I've been enjoying the morning. How you doing?
Man, I'm doing great. And it's Friday. So Dr. Brown is a emergency room physician. I've heard from some of my other docs that sometimes things get a little weird in the ER during full moons. Have you found that to be true?
I think that's about as consistent as Friday the 13th stories. Anytime that there's this lore around weird stuff, the hospital tends to see that, and then the emergency department gets the bulk of it. So, it's pretty true.
Well, this is day 3 of our full moon, so you have some fun.
Listen,
at
when the
work
werewolves
tonight.
come, I know what to do.
Oh, there you go. There you go.
Man.
So at the top of each of our show, we'd like to discuss a current event. And you being a physician, I wanted to bring you in on the current event discussion because it was just announced this week that the Biden administration, along with the White House, are going to negotiate on behalf of Medicare to lower prices of 10 very popular and expensive drugs that are used to treat things like diabetes, heart disease, and other chronic illnesses. By the way, in case you weren't aware, heart disease is the number one killer of Americans. Okay. Am I still right on that? That's still the statistic. I don't think it's changed.
Yeah.
Okay.
Number one killer overall.
I know it firsthand. Grandma, and dad. Okay. Number one. Okay. And I remember the conversations that I was having with my father with the inaffordability of his medications. Okay, so this is big. This is exciting. Now, is it going to have some impact for those of you that got your finance hat on? Like, oh, what's going to happen to my pharmaceutical stocks? They'll be fine. I don't know if they'll be fine, but I care more about the people when it comes to this situation. So I'm happy to hear that. So with that, Dr. Brown is an expert. This is where I heard him speak on the topic first on health equity, which was a new word or new phrase for me a few years back. And I believe that this move that's happened with the Biden administration has a lot to do with health equity. So can we start with just defining for the people, what is health equity?
No, certainly. So I'm really happy that you are encouraging people to be a little bit more familiar with the words and the vocabulary surrounding issues of health disparities and health equity. So health equity is essentially making sure that people, no matter what background they come from, what classification that they're assigned or that they identify with, has the opportunity to have the best possible health outcome. That means living a long life, living a life that is fulfilling, has high quality, being able to have access to all of the things related to healthcare and the healthcare ecosystem. So seeing hospitals, doctors, having nursing staff, end of life care, everything at the same equitable and just measure. as any other person who is, I guess, walking the earth. So the main thing is that people typically confuse equity and equality. The words sound very
Mm,
similar. They sound, I mean, I literally feel like in media they use the words interchangeably, and that's part of the reason why we don't know how to tease them apart. Whereas equality, we're talking about resource allocation, just giving everybody the same exact resources, no matter what their circumstances are. But equity focuses more so on allocating those resources based upon the circumstances so that you have the opportunity of an equal outcome among all of the stakeholders. So that's why health equity is so important. And a decision like this to change the prices of so many of these life-saving therapeutics and management medications, that is going to change outcomes. It's going to improve people's
absolutely.
long-term health outcomes. So I'm excited to see this.
Absolutely, I agree with you. So before we jumped on, I had to, just so that because I didn't want to make the same mistake, like you said, of basing equity on equality. I said, you know what? Let me just go look up the definition of the word equity. So I want to share it with everyone, because I know for a lot of you that listen to this podcast, my long-term listeners, shout out to all of you. Thank you so much. Oh, thank you for all the great ratings on Apple Podcasts too. They keep coming in. Thank you. Do some more. We like those. That, by the way, that helps more people get to see the show. So that's great, or hear the show. So equity, if you listen to the show, we talk about equity in the sense of financial equity. So the values of share prices, et cetera, we look at those as equities that you can invest in. But when I look at the definition of equity, and this is according to Oxford, there's two definitions. The number one is the quality of being fair and impartial. And the example it gives is equity of treatment. Look at that. The second definition is the value of shares issued by a company. So he owns 62% of the group's equity, is the example. What I'm hearing you say is that when we're looking at health equity, it almost sounds like it's a blend of those two definitions.
Yeah, I would say that if you're thinking of it in the context of ownership, right? That people should have a stake in living a good life. They should have a stake
No, no,
in
no, let's
living
no,
a
no, no,
long
no.
life.
Let's no. Let's let the silence sit there for it. Say it one more time, and let's just let the silence sit there. One more time.
I said that people should have a stake in living a long life or in a good life, right? Like I would want the best possible chance. I would want as much equity in that as possible.
Yes.
And then the other
Yes.
side of things is thinking about compared to other groups. Like I should have the same chances, the same potential, the same opportunity as any other person.
Mm, mm. So I feel like the we talk about this in finance a lot. The idea of pulling forward earnings, or pulling forward sales. So the pandemic pulled forward a lot of the future earnings of technology companies, because everyone had to go Zoom and work from home, and those, not everyone, because you didn't at the hospital, but a lot of people had to do that. And so a lot of companies were making money that they were seeing customers they probably wouldn't seen for 5 more years, and they got them in 5 months. So we had that pulling forward of the valuations of some of those companies. Have you found that with the pandemic, did it also pull forward the conversation of health equity, because everyone was affected
Yeah, no,
equally?
I'm going to borrow that term because I think that's the appropriate analogy. It literally made it a dinner table conversation. People were no longer able to ignore the importance and significance of health equity because we saw it firsthand. The pandemic laid bare for us what true health disparities look like. And many people who were affected by those things had similar traits. And we were able to, for once, say, this doesn't look right. It doesn't seem right or feel right. And it affected everybody universally. So at the same time, people were suspended, in time, in gravity, essentially, and had to focus, couldn't run away from it, and that's where you start to ask yourself critical questions like, what are my values? What are my morals? Do I know right from wrong? And in that discussion, that internal monologue, people realized that folks were dying. because things that we had thought were right and were wrong all along.
Mhm. Yeah, I remember having conversations. I had to remind some clients, some friends, just even family members. I had to remind them that the virus does not care your social economic background, your skin tone, your sexual orientation. All it sees is, ooh, host. That's
Yeah,
it.
yeah, yeah. I mean,
It did not care. However, the quality of care that you received for some reason in these great United States of America, there was a great disparity.
right. No, that's the real goal there. Or not the goal, but the real fine print is, yeah, the virus doesn't discriminate, but our care systems do.
Mm.
And our circumstances are very much so based upon systems of discrimination. And so that's the reason why we saw these disproportionate outcomes. And it's like you said, that pull forward effect where people were now given language that they never had to explain this dynamic and explore what solutions could look like. And as a result, we got a push for the health equity movement for people who have been fighting for this for honestly 50 plus years. So I am grateful for the fact that people had to come face to face with this discussion. And I'm thankful for the many new recruited health equity warriors that we've now enlisted in trying to right these centuries worth of wrongdoings related to healthcare and health disparities.
So let's start. Let's talk about we've talked about the problem. Oh, do that again. Can hit my microphone. So we've talked a lot about the problem. Let's talk about some of the solutions, and I'll begin from the financial aspect. Um, I am so grateful for the Affordable Care Act, also known as Obamacare.
Mhm.
Okay. Now, for those of you out there who are fans of Obama, you probably have no problems associating Obamacare or associating the Affordable Care Act with Obamacare because the terms are synonyms. Okay. But I had to work with some people that would say, oh, I don't want Obamacare. And I was like, okay, well, how about we get some insurance from the marketplace through the Affordable Care Act? Yeah, I'll do that. I'm like, oh gosh. But the beauty of the Affordable Care Act is it made health insurance more equitable. Okay. Some of the biggest hurdles that health insurance had for, and this is, and let me go back, take a step back and talk about from a
Mhm.
financial standpoint. You can save as much money in the world. You can save all the money in the world. Okay. But if you don't have your health, you won't get to enjoy it. Okay. Or you'll spend most of it just trying to stay healthy. Okay. Healthcare costs and taxes are some of the biggest killers of retirement plans. I've seen it happen
Right.
in real time. So making health insurance more equitable, more accessible to more people, and removing things like waiting periods for pre-existing conditions, limits to how much the insurance company is going to cover, giving more options for the HMO, the EPO, the PPO, making the HSA much more accessible to people was a game changer for many of
Mhm.
the clients that I work with. And I'm also telling you as a listener, guess where I get my insurance from? Obamacare. I'm a small business owner. If my
Right.
business is below a certain size, there's really no real options out there for discounts for health insurance. So instead, we set up a program where we reimburse our employees based on if they wherever they go get their insurance from, whether it's their spouse's insurance or they go to the Affordable Care Act, we give them a little stipend for it. But my insurance that my wife is on, I'm on, my children are on, I get directly from Affordable Care. Now, is it the least expensive thing in the world? No, it's not. You pay a lot of money for insurance. That's a battle for another time. But we have access to it. And I tell you, I've had COVID twice. Okay. And in both of those situations, I was very grateful I could just hop on a little telehealth call with my doc. And he's like, all right, what do you need? I'm like, well, I got the cough. I got the this. I got the this. All right. It's at the pharmacy. Go pick it up. Okay. And in
Mhm.
those moments, I'm grateful for that access. And so I've had lots of clients that had to go through the losing the job. through the pandemic and some of the changes that our economy's been going through, and then they have choices: Cobra or
Yeah.
Affordable Care Act. A lot of times, Affordable Care Act's the way to go. It's less expensive than having to pay the cost of their employer service. So that is an example of how how things are changing, and in my opinion, becoming more equitable for all Americans. Dr. Brown, what are some of the other things that you've seen change, especially since COVID, since this catalyst, and what are some of the things that we should be working on right now?
Well, we really have to look at it in phases, right? So the the beginning of the pandemic, there was a significant amount of uh, or a lack of clarity around this illness, and it really caused people to put an all hands on deck approach to a lot of things, right? So we increased federal spending very quickly, and in doing that, these appropriations committees started to funnel money towards a lot of other health initiatives. Organizations that have been doing groundwork or grassroots work in health spaces got boosts of income or money so that they could do more COVID testing. But on the back end of that, there was also the ability to do more screenings, not just screenings for COVID, but screenings for almost every single preventable condition. And so you saw an increase of access to these things because regular testing sites also doubled as places where people could get basic screenings and basic tests, right? Then you also started to see this like surge of access to other therapeutics and medications, which really leads to this conversation that my friend, I have a really good buddy. He follows pharmacoequity. He is a literal genius in this space. But the point is, you would not have conversation around changing costs of medications if this didn't come on the tail end of pandemic funds being surged into it. So, shout out to the
Oh yeah, because the
UTBA
government was
SE.
like, wait, how much we got to spend for this?
Yeah, no.
Wait.
So I got a name drop. His name is Dr. Utibe Essie, and he's at UCLA. He's been doing this work for a while, and maybe one of the greatest forces in pushing pharmacoequity from a literary sense and a research sense, but also at the level of federal conversations. So I would sit on a White House roundtable group. Every month, we'd have this conversation around what are the biggest pressing issues happening federally or in the communities that we see. And constantly it was the same things: increasing access to testing services for COVID, increasing access to the therapeutics related to COVID, then looking at chronic conditions, empowering organizations that are already doing this work to continue to do it, and then changing the price of these medications and therapeutics. So suffice it to say, this is one of the biggest pushes from the pandemic is changing these prices and it's increasing the access. Now, you just said earlier in this show that you've seen the financial toll that paying for these medications takes on a family member or on a family entirely. And so imagine what that feels like over the course of a disease and for people who are fighting tooth and nail. So, insured, uninsured, that financial burden is still real. Whether you have Obamacare, you have Cadillac insurance, or you have no insurance, it's all relative. Like whether this cost is something that affects you significantly or just a little bit, at the end of the day, we still know the numbers. We know the deaths that come from not complying with medications or not having the ability to afford these medications. So I'm super excited about that in the sense of changing the access dynamic.
Mm. So for our listeners that are not in finance, that are not fellow physicians and nurses that are in the trenches with this and working with people through this problem, what are some of the roles that everyday Americans, uninsured, insured, what have you, what are some of the roles that they can take in improving health equity for all?
Well, I think let's start with people who, so uninsured, insured, employed, unemployed. I think the first real thing is understanding your disease risk. Like, know what
Mm.
your family history is to the best of your abilities. I know that for some communities, it's harder to track whatever your family histories are, but your family medical history is huge, right? I think the second major thing is understand what are you at risk for or sorry, what are your risks from a social standpoint? Like, are you in a certain community? Are there regional risks that you should be more aware of? I'll give you a perfect example, right? So if you live in a rural community, right? Say you live somewhere where to get to the nearest hospital is like an hour to 2 hour drive. And that doesn't necessarily mean it's the best hospital, it's just the nearest hospital. Your health risks are going to be different from a work standpoint. Like if you are someone who is working in the inner city and you do a part-time job or multiple part-time jobs, that may change your health risks. And the quality of what that work is can change it as well. So start looking inward and saying, what are those things around me that are not necessarily changeable? Those characteristics that I may not have control over that increase my risk, right? So family history is one of those things. Environment, what your community looks like. Those things you can't necessarily turn a light switch on and change. And then you start looking at behavioral issues. So things that you choose. What is your diet? What is your exercise? Like those modifiable characteristics that increase your risk. Do I smoke? Am I someone who drinks a bottle of wine a day, or is it, only socially or never at all? Start putting these
Wow, you
pieces
went straight to a
together.
bottle. Well, that was.
I'm
I,
just
I
look. I work in an emergency department.
okay. You right. All right. All right. Fair
Some
enough.
people come in with the bottle. At the end of the
All
day,
right.
yeah, I'm just
All
letting
right.
you know. At the end of the day, it's your ability to assess your own risk and the multifactorial element of that risk or the nature of that risk that's going to give you the best chance to understand equity, because this is what you start with. This is
Mm.
where that starting block is placed. Now we can start to discuss, how do I collaborate? How do I increase education and change the channels of education and information so that people have the same access to insight that I have, right? Like I'll speak very clearly. I grew up, I didn't have a first degree relative who was a physician. I didn't have access to health educators and people who were nurse communicators and that could tell me what a hemoglobin A1C was, who could tell me that a
Wait,
blood pressure.
that's sugar. That's sugar. Diabetes. It's that one.
Correct.
All right.
It
There
is
we go.
a marker, a proxy measure of what your blood sugar is.
Just had a
So
physical last week, so I'm just
yeah,
okay.
but imagine getting a physical and not being able to interpret any of the information, or
Mm.
someone telling you something as simple as like, well, we know that there's an association between eating this type of food and developing this type of heart disease, or someone sharing information with you about, oh, if you live this close to a freeway or to other place where it has natural pollutants, you might have an increased likelihood of asthma. So
Mm.
having these types of conversations, they're all equity driven. They've been distanced from us from a community standpoint, a historical standpoint. And so what I'm simply saying is we now have access in a way we've never had before via podcasts, via social media. And although filtering them is the new challenge, like figuring out
That is
what
the
is
new challenge.
reliable
Yes.
information and accurate information, we still have, you can reach a doctor right now. You can go on an app on social media and just send them a message, and you can reach a doctor. So that level, that proximity has changed, which means that our understanding and our health literacy can also change concomitantly.
Mm. Those are big. So I heard. So one is assessing your risk from a environmental standpoint and a historical standpoint, which sounds a lot like financial planning. That's something we do. It's something we talk about here on the podcast. Is assessing your risk. What have you done in the past? What did you learn about money in the past? Things of that nature. I also heard you say assessing risk just from a standpoint of what you do. What are some of the habits you already have? Again, we talk about this in finance. These are your financial behaviors. Dr. Brown saying, what are your health behaviors? What are the things that you
Right.
do that could be precursors to something else? You
Mhm.
heard me mention at the top of the show. I mentioned grandma, dad all died from heart related issues, heart attack, stroke, and stroke. Yeah, well, stroke and then heart failure, but all heart disease. Okay.
Mhm.
I have to be acutely aware of that as I think about the decisions I make in my life. I look at my father. We used to look at my father like, oh, he's healthy because he was a vegetarian. Vegetarian doesn't make you healthy. Not doesn't make you heart healthy, because you know what? He still fried a lot of his vegetables. Okay. He did not exercise regularly. Yeah, he did. He worked outside. He'd work in the garden, or he was also a contractor. So he'd work on houses, but of actually elevating his heart rate and training his heart, he didn't do that. Okay. So I'm aware of those things. So I think about the foods that I eat And I also think about my own exercise regimen, make sure I'm doing exercises. I wear my watch and I monitor my resting heart rate because I know I want to keep a lower resting heart rate. And I've gone back and looked through my watch and my heart rate, and I can see where I've been sedimentary because I see that resting heart rate just go up. And I'm like, man, I'm up there. I'm chilling at 80 versus the 65. Like I should be in the low 60s. But because as I start exercising again and get back in that routine, I see it go back down. Now, is it going to be perfect? No, but that's why I get the physicals every year. And one of the things that came in my physical recently, the doctor said, you know what? Your cholesterol is right at that level. Like it's not so bad where you need some medications for it, but you got to work on your diet. And I had to think about it. I was like, yeah, I get to work on my diet if I want to try to combat, because some of these things I'm inheriting. I can't do anything about it. All I can do is put up a good fight. Okay. So that's something I want to encourage all of you to do, because I want you as a listener, as a viewer of this podcast, I want you to take something from these episodes that you can go out and go do to improve the quality of your life. Financial literacy is one of them. Health literacy is just as important, if not more important, because who said it? It was one of the rappers. I think was it Pusha T? I want to say it's Pusha T. Push, if it wasn't you, I apologize to whoever actually said it. Ask Steve Jobs, wealth doesn't buy health. Steve Jobs was one of the richest people on the planet, and it couldn't do anything for pancreatic cancer. He had everything. Financially, he had it all. But he couldn't buy those body parts again. He couldn't undo a lot of the damage that had been done. Okay. So again, and we know, if you go back and read his story, I mean, he knew that he was living with this disease for a long time, and he still lived the best life he could with it. And that's what we get to do. That's what we get to do. So listen, this has been an amazing conversation. Thank you so much. I am now, I'm as invigorated as I was the first time I heard you speak on this topic a couple years back at one of the conferences, and I got all hyped up and jazzed about it, and it's happening again right now. I want to transition before we get to one of the key parts of our show. I follow you on the social medias, and by the way, if you're not following him on social, what's your hand on social media? I got to hear somewhere.
At GR8 Vision, at Great Vision.
Great, that's a Great Vision. I know that. I could do that. At Great Vision. Okay.
Right.
Amazing gentleman to follow in all sorts of content. But you had something that struck me that I've talked about on the show a few times, and I want to bring it up. Is you gave a tribute to Magoo, who unfortunately passed away in my eyes prematurely. I believe he was 50. I think it was. Was that?
Yep.
Yeah, 50 years old. I haven't gone back to see if they've revealed a cause of death or anything like that. And I didn't really look too deep into that. But one of the things that came up for me, and I just want to mention it here on the show today, is that there is also, when it comes to this health equity and financial literacy, there's a place where they converge, and that is in estate planning. And I talked about this on a previous episode with a real estate agent. Because we don't know when our last day will be, we get to plan for that last day.
Yeah.
Okay.
Yeah.
And unfortunately, there is a disproportionate amount of superstars, idols that we look up to, that don't do this work. Okay.
Yeah.
Prince didn't do this work. Aretha Franklin didn't do the work. Jimi Hendrix didn't do the work. Are you ready for this one? Dr. Martin Luther King did not do the work. What's the name from the Migos? Takeoff didn't do the work. Chadwick Boseman did not do the work.
Yeah, it's sad.
Okay.
It's something I speak about very openly. My concern for specifically artists in hip hop, and just generally being disadvantaged in terms of having resources that are pushing them to understand these types of dynamics, these types of things. For example, I think that Jay-Z is one of the greatest people to actually champion doing this upfront. Like as soon as you get your first, set of money or $1 million, he's like, yo, you gotta get these things out of in line. And he talks about financial literacy. And part of financial literacy is not just the Yo Gotti approach of let me buy up a whole bunch of different, real estate
Buy the
properties.
block and
Right. Yeah. I mean, I understand the desire to buy the block, but you have to do the estate planning. You have to think about end of life care. These are extremely important things. And then for these artists, I think that the biggest challenge here is just not having reliable people to turn to. There's such a resting distrust of anyone, advisors, of friends, of, hey, I got a friend that does this. Like they hear this so commonly because they are seen as this like walking, rhyming bag of money. That's how people see them. As this
walking,
like
rhyming bag of money. That's great.
They see them.
I had the vision of a bag of money that's rhyming.
That's spit in the bar, right?
Yeah.
So that's the reason is because people see them as this new hood bank teller. And they're like, well, I'm getting all of these requests at once rather than thinking about it in the sense of what do I really think, is of true value? Health, long-term decisions, and being able to create some type of a system in myself on how I decide what I spend my money on. And so when it comes to estate planning, that to me is one of the few things that these artists could do easily that changes their long-term trajectory and their family's trajectory. So instead of giving, cousin Joe some money so he could start his food truck, you could actually write in your estate, when I die, I'd like cousin Joe to get X. And so given that and the other risk factors that exist for a lot of these rappers, I'm like, it even makes more sense. And this is kind of a bleak reality when I look at the average, the life expectancy for Black men and life expectancy for Black men who are in hip hop. Like there's a discrepancy in those numbers, which is part of the reason why it is more in their favor to do the estate planning as early as possible.
If you need someone that's reputable, I know a guy.
maybe just one guy.
Maybe just one. Actually, I know more than one. I know many people that can help you do this and get it. And because another part of the estate plan that a lot of people don't think about, and you mentioned it, and that is the end of life care. Because not all of us are just going to drop dead of a heart attack. Some of us it'll take could take weeks, if not months, for us to make our transition, because meanwhile, everyone around us is trying to keep us alive. It's a little joke we tell in the estate planning when we're helping clients with it, is that, the hospital won't kill you intentionally, but they can let you die, but they need your permission to do that. So if you haven't written out, okay, these are the treatments I do and don't want, this is how long I want my loved ones to keep me on life support, things of that nature. If that's not there, it is their job to keep you alive. Yeah. That's part of their Hippocratic oath, is to keep you alive. They want you out of the hospital. Okay. Yeah. Actually, a lot of their financial incentives are tied to you leaving.
As soon as they can turn the bed over.
Yeah. It's like, no, we need this bed empty. Okay. We need you to go home. So making sure that you have those other pieces like directive of physicians and medical power of attorneys and HIPAA agreements and those documents there, so that someone else can speak on your behalf, or so that at least your primary care physician says, actually, nope, I have their notarized healthcare proxy, and they said, just let them go. Actually, it says right here, do not resuscitate. So if they go, they want to go. And that's okay too. But if they don't know that, if they don't have access to that document, they can't make that decision for you. They can't. So I encourage you, if you're someone listening to this right now and you know that you do not have an estate plan in place, start doing some research. Feel free to reach out to us. There's lots of low cost options to help you get that done. There's even some states where cities will offer free estate planning services for those that don't have the means to do it. Okay. You just have to look it up and find out where it is in your city, when it's happening. You probably have to show up at the library, and they will help you get those documents done, including the notarization. Okay. And again, that's part of, again, that health equity. This is something that has been commoditized so that more people have access. When my wife and I did our will and trust many years ago, the first time we did it, we paid almost $5,000 to get those documents done. That's a lot of money, but I knew it had to be done. I lived in California. I had stuff. I was like, I went through probate with my wife's grandfather. I was like, we're not going through that. We'll pay the money to get it done. Today, we can get those same documents done for $1,500. Okay.
That's crazy.
That's leveled the playing field and made it a lot more accessible to more people, which is definitely what we want. So, all right, we'll be on our soapboxes all day, but I want to be respectful of everyone's time. So I know you're waiting to hear about it because I want to hear about it too. Italo, what is your first memory of money?
I probably would say maybe 3, maybe 4 years old. My mom and my dad had given me a piggy bank. All right. And it's weird because it's like, why would I remember this? Well, one, I remember because it was one of them old school ones that was like basically metal. It was made out of, it was like,
it was an actual pig. It was
metal like
pig?
an actual, no, it wasn't a pig. It was like
okay.
a house.
Okay.
Yeah, like a die cast metal house. And in the chimney was a little sliver, and you just drop the money in there. And I just remember being like, first of all, it was a blunt object that on many occasions I got hit upside the head from my sister or playing in the house. And so I remember that piggy bank for the wrong reasons. However, it got heavier. It got heavier because I was putting money in it. And so that's one of the things that I kind of remember is this idea of saving and how to save, something that my mom was really serious about. And then I would say that the other reason why it was important to me was because when you're a child, especially in the time frame when I was a kid, money had a different value. You know, you could literally use $1 in a way that you can't use $1 now. And I just thought of it as freedom. You know, if I wanted something, I could get it because I had saved and I had something in there. I never let it get empty. And so that to me kind of set the tone for how I approached saving money and making sure that I was never at rock bottom. So that's my earliest memory.
Never let it get empty. I like that. Well, Dr. Brown, thank you so much for joining us on the Money Script podcast. This has been an incredible conversation. I can't wait to do it again. We will have to do it again. I'm sure we'll see each other at ASEP in Philly.
I'll be there.
You'll be there. All right. So I'll see you ASEP in Philly. For those that want to reach out to you or learn more about some of the other stages you're going to be on, where can they learn more information?
Yeah, if you go on Instagram or Twitter, I'm at Great Vision. If you look up Italo Brown MD, I'm on LinkedIn. You can connect with me there. I do YouTube as well. In fact, there's a pretty nifty YouTube video from a few years ago I did with GQ where I talk about movie injuries. And so go ahead and watch that, and you'll see that I'm the real deal when it comes to this hospital thing. Outside of that, I'd love to talk health equity and wellness and hip hop. Oh, and while I have you, if you're not busy, the weekend of May 17th, there is a wonderful celebration happening in Atlanta, known as Graduation 2024. I've seen this celebration.
I've heard, but well, it is open to all, especially to alumni. So if there's nothing in your calendar and you happen to be there, I'm sure there'd be a lot of people who love to see your face again.
I will definitely put it on the calendar. I'm going to throw another date at you. October 27th to 29th. This is your homecoming.
That it is my homecoming.
Absolutely,
yes,
be there.
Yes, that is in my calendar. I will be there. This will be my first Morehouse homecoming in many years.
Well,
many years. So, but my first going to a homecoming as a student.
There you go. It's much to celebrate.
Yes, indeed. Yes, there is. Well, thank you so much again for spending some time on the Money Script podcast. Remember, everyone, please engage in your own health equity. Understand what your risk tolerance, what your risk is. See, risk tolerance, I'm thinking finance. Understand what your risks are. Understand the things that you can control, the things that you can influence, and the things you have no influence or control over whatsoever. Just focus on the control and influence, and more on the control than anything else. Okay. There are so many things that are in your control that you haven't thought of them yet. Okay. Also, if you know someone that, especially an elderly individual or any individual that is affected by the cost of these drugs that is going to be changing, let them know that change is coming. Support them where you can, and also help them start to come up with a plan so that they're not, trading their medications for rent. Okay. Help them come up with a new plan. Because once this all, goes through and things really change, that's going to change the financial lives of those individuals as well. So make sure you're there to help them plan through that. And then, of course, as I said at the top of the show, tell a friend to tell a friend, where you can hear this podcast everywhere. You have no excuse. This is your dose of financial literacy, and today, health literacy as well. And we will see you next time. Take care. Thanks for joining us on the Money Script podcast. Be sure to check out our other episodes, subscribe, follow, and give us 5 stars. Continue to send your financial questions on Twitter or Instagram at the Money Script. Go to moneyscriptwealth.com and schedule your complimentary consultation to discuss your specific goals and concerns. Financial advisory and investment management services are offered by Money Script Wealth Management PLLC, a registered investment advisory firm registered in the state of Texas and California and other states where exempt. The Money Script LLC and the Money Script Wealth Management PLLC and guests of the episode may have interest in the investments mentioned today. The opinions and views are expressed here are for informational purposes only. This material is educational in nature and should not be deemed as a solicitation for any specific product or service. All investments involve risk and a significant loss of principal. The Money Script nor Money Script Wealth Management offer tax or legal advice. Please consult your tax advisor or attorney for specific advice about your situation. Until next time.